Hello everyone. Today we are going to read one of the important topics of anatomy. Often comes in the exam with the shoulder girdle and shoulder joint. Okay, so let's start. The shoulder girdle. What is shoulder girdle? Shoulder girdle is the functional body unit formed of the clavicle and scapula. Okay, what are the movements in the shoulder girdle? Moves at two joints. One is sternoclavicular joint, one is sacroiliaclavicular joint at the same time. The main movement of the shoulder girdle is carried by the scapula. Okay, so what are the movement of the shoulder girdle? We'll see. Movement of the shoulder girdle is one of the elevation of the scapula, that is shrugging the shoulder. The muscle responsible for is the upper fiber of the trapezius and levator scapulae, and which is checked by the costoclavicular ligament. Number two movement is the depression of the scapula, that is dropping the shoulder down. What are the muscles responsible for the movement of the depression of the scapula? The major muscles are the pectoralis major, pectoralis minor, latissimus dorsi. Okay, and the ligament which is checked by the interclavicular ligament and articular disc of the sternoclavicular joint. Okay, the next movement is the upward rotation of the scapula. Upward rotation of the scapula is the glenoid cavity is directly upward. At the upper fiber of the trapezius, lower fiber of the trapezius, and the serratus anterior. The muscle responsible for the movement of the upward rotation. See, here is the upward rotation movement of the scapula, and downward rotation movement of the scapula. Muscle responsible is levator scapulae, rhomboid major and minor, and the pectoralis minor. Okay. Next one is the protraction. Protraction movement is roll the serratus anterior and pectoralis minor, the muscle movement, and the next one is the retraction of the middle fiber of the trapezius and pompodius major minor are the muscle responsible. So these are the one, the shoulder girdle. Shoulder girdle, the movement of the shoulder girdle. Okay. Next we come to the shoulder joint anatomy. So what is the shoulder joint anatomy? This type is the synovial type. The subtype is the ball and socket type. Type of here is the synovial type. It is the ball and socket type. Here the articular surface, the shoulder girdle, sorry, the shoulder joint is formed by the, or the definition will be the articular surface. Here, first the head of the humerus. Here, the head of the humerus. Ah, the ball, it is less than the hemisphere covered by the hyaline cartilage. And next one is the glenoid cavity of the scapula. This is the glenoid cavity of the scapula. This is the glenoid cavity of the scapula. Okay. The glenoid cavity is the pear-shaped shallow cavity. It is defined by the lip of hypocartilage that is known as the glenoid labrum. Okay. So, shoulder is formed by the head of the humerus to the glenoid cavity of the scapula. That will be the definition of the shoulder girdle. Right now, the capsule lies in the shoulder girdle. It is thin and lax attachment medially at the scapular end and laterally at the humeral end. Okay. Now, openings of the capsule are the anterior perforation, lateral perforation, and posterior perforation. Okay. The factors supporting the capsules are the tendons, the muscle, which is known as the muscle cuff, the supraspinatus tendon, infraspinatus tendon, the subscapularis tendon. The supraspinatus tendon lies superiorly here, supraspinatus tendon, infraspinatus tendon which lies posteriorly, the subscapularis tendon anteriorly. Okay. The capsule is supported, the shoulder joint capsule is supported by this. Okay. The next one is ligament. Ligament is the coracohumeral ligament, glenohumeral ligament. Okay. The glenohumeral ligament lies superior, medial, and inferior glenohumeral ligament, and the transverse humeral ligament. The intra-articular structures, the important intracapsular structures of the shoulder joints, which are the synovial membrane, glenoidal rhabdom, and tendon of the long head of the biceps. Okay, this. Now one question comes: what is the synovial membrane? Synovial membrane lies the inner surface of the capsule, and it is reflected onto the intracapsular part of the surgical neck of the humerus. Okay. Next, extra-articular structures. At the superiorly, it comes the supraspinatus muscle, subacromial bursa, and coracoacromial arch. And anteriorly, it comes suprascapular bursa and subscapular muscle. Posteriorly comes the infraspinatus muscle and teres minor. Inferiorly comes the quadrangular space. Okay. Now the bursa related to the joint. There are 5 bursa. Okay, subscapular bursa, infraspinatus bursa, subacromial bursa, and subcutaneous bursa. Also, there may be a bursa present between the coracoid process and the capsule of the joint. Now, the most important part of the shoulder joint is the movements of the shoulder joint and the muscle acting or muscle helping the movements. The movements allowed of the shoulder joint is three-dimensional movement. Okay, the flexion extension, abduction adduction, medial rotation, lateral rotation, and circumduction. Okay, the muscle acting. What are the muscles for the shoulder joint? Okay, muscles are the comes for the flexion movement. Main flexions are the what are the main flexors? The pectoralis major and anterior fiber of the deltoid. The main flexors, and the assistant flexors are the coracocervicalis and long head of the biceps. Okay. But now comes the extensor. What are the main extensors? Are the posterior fiber of the deltoid and latissimus dorsi, and assistant extensors are the teres minor and sternocostal head of the pectoralis muscle. Abduction movement. Abduction from 0 to 15 degree, it is carried out by the supraspinatus muscle, the abduction carried out. And next 15 to 90 degree, it is carried out by the middle fiber of the deltoid muscle. The rotator cuff muscle stabilize the head of the humans. Okay. The abduction from 90, okay. The abduction from 92 here is the trapezius and serratus anterior muscles. Okay. Now the adduction movement. And the main adductors are the pectoralis major, latissimus dorsi, and teres minor. Assistant adductors are the subscapularis, infraspinatus, and teres minor. Next, medial rotation. The main medial rotation are the anterior fiber of the deltoid, pectoralis major, latissimus dorsi, and teres major. Assistant medial rotators. What is the medial rotators? Medial rotation is also known as the internal rotation. Okay. The assistant medial rotators are the subscapularis muscle. Next, lateral rotation. It comes, which is the movement are the muscles prime movers are the posterior fiber of the deltoid, infraspinatus, and teres minor. Okay, so these are the movement and muscle performing the movement of the shoulder joint. Now, the surface anatomy of the shoulder joint or joint line, it is not so much important, but the arterial supply of the shoulder joint, you can say anterior circumflex humeral artery, posterior circumflex humeral artery, suprascapular artery, and subscapular artery. Nerve supply is mainly supplied by the four nerves: axillary nerve, musculocutaneous nerve, suprascapular nerve, and lateral pectoral nerve. Okay. The stability comes from the bony factors, the capsular factors, and the muscular factors. Bony factors are the two bones united and form the joint at the head of the humerus, and the shallow part is a glenoid cavity which forms the joint. At the bony parts factor for the stability of the joint, the capsular stability, The capsule is lax and weak, allowing the separation of the articular surface by 2 to 3 centimeter. The ligaments supporting the capsule are the weaker part. And the muscular part, the inferior aspect of the joint is not supported by the muscle due to absence of the quadrangular space. Okay. It is one of the applied, now the applied anatomy is the most common site for dislocation of the joint throughout the inferior aspect of the capsule, which is the least supported part of the raising of the arm above the head. The dislocation of the head of the femur downwards in the quadrangular space lead to the injury of the axillary nerve, posterior circumflex humeral artery. Okay. Now, it's the topic is completed the shoulder joint. Okay. Thank you.